There's a slight change in the program today. The First Minister of Wales is unable to make his commitment, but he has deputized the Minister of Health and Social Services, Baroness Morgan, to give a talk on his behalf. We will now run the introduction by Mr. Ajay Sharma for the Health Minister. So it's over to Ajay Sharma. Thank you very much.
It gives me great pleasure in introducing Baroness Morgan, Member of the Senate and Minister for Health and Social Services of Wales. Baroness Morgan was born and brought up in Cardiff. She won a scholarship to the United World College of the Atlantic and gained a degree in European Studies from the University of Hull. Baroness Morgan earned her stripes early on, being elected as the youngest member of the European Parliament at the age of 27. She was only the 5th woman to be elected to a full-time political post in the history of Wales. Baroness Morgan brings with her immense and diverse experience. She represented Wales for the Labour Party from 1994 to 2009. In this role, she was the Labour spokesperson on industry, science, and energy. Way before green energy became mainstream, she authored the Green Paper on Energy on behalf of European Parliament and led the Parliament's discussions on Electricity Directive and the issue of fuel poverty. Baroness Morgan then served as the Shadow Minister for Wales in the House of Lords and as the Shadow Minister for Foreign Affairs. She was elected to the Welsh Assembly in 2016 and appointed Minister for Welsh Language and Lifelong Learning the following year. In 2018, she became the Minister for International Relations and Welsh Language. Just over 6 weeks back, she was asked to serve her nation in the most challenging of times as the Minister for Health and Social Services. Friends, you would agree with me that Wales is lucky to have in Baroness Morgan a very experienced, capable, and a people-centric minister. We, the British Indian Orthopaedic Society, wish her great success and assure her of our commitment to support her government's initiatives in the coming days. Over to Baroness Morgan.
Well, thank you very much. Thank you very much for welcoming me to this conference, and congratulations on hosting such an incredible event. I had a look at your agenda, and it seemed very, very rich indeed. And I'm sorry if some of you are hearing me twice during this conference, but I would like to start by giving apologies on behalf of the First Minister. I know he was really, really keen to be with you today and is very sorry that he has been unable to attend. So please accept those apologies on his behalf, and I hope you won't mind if I deputise on his behalf. But it is a huge pleasure to welcome you even virtually to Cardiff. I'm actually speaking to you from St David's in Pembrokeshire, but from the conference outline, I know that you've already had very varied and stimulating discussions, and I'm very pleased to see that you're planning to have a Welsh perspective on orthopaedics from Owain Ennis, who is one of our most experienced consultants working in Wales. And I've always been a huge admirer of the work undertaken by the British Indian Orthopaedic Society to promote exchange of knowledge and culture across our different health systems. And we're particularly pleased, of course, and proud in Wales because Aneurin Bevan was a Welshman. It was his inspiration that established the NHS. And of course, we are celebrating, I think it's 73 years of the NHS this week. So this two-day conference hosted in Cardiff follows in the same rich vein that you have in the past, and I hope you will have a successful few days. I think it's no overstatement to say that these last 15 months have been some of the most difficult and challenging many of us have known. And I want to open my remarks today with a very simple message of thanks for all of the dedication and the skill and flexibility you've shown over that time. And despite the challenges we've faced, we've collectively achieved an incredible amount in supporting patients through such a difficult and unique time. And I know that our clinical community has truly excelled and shown the very best of Wales. And in particular, it's shown creativity and innovation to ensure that patients get the best possible care under some of the most testing and challenging of circumstances. Now, in Wales, we value hugely the contribution of all of our health and social care professionals. And I want our links as a health community in Wales with our members to strengthen over the coming years. And in particular, I want those links to grow as a way of helping us all together to think about the shared health challenges we all face. I know that professionally, the pandemic has impacted significantly on all surgical services, and orthopedic services in particular have been hit hard. It's a challenge for all those involved in delivering care to think carefully about how we support the significant number of people now waiting for treatment as a result of the pandemic. And I know that it keeps me awake at night thinking about the pain that so many of our fellow human beings are suffering during this really difficult time as they await those treatments. Now, there's no easy answers, but it's the dialogue, the professional engagement, and the two-way exchange promoted by events such as these that help us to think and work our way through the challenges we face. Now, the uncertainty of when services will return to normal has continued as we've moved through the various cycles and strains of the virus. We all know that we still have some way to go before life and the vital services we all rely on return to full capacity. Now, I recognise the challenges placed on you as practitioners. The impact the pandemic has had not only on essential and emergency elective care, but also on specialist training to future consultant staff and support trainees has been impacted. So I want to give you a really clear message today. There are, we know, no easy answers to the challenges we face. But in Wales, we are committed to ensuring that in thinking through the challenges of providing high quality orthopaedic care for the future, we do that in a spirit of partnership, of collaboration, and of respect. And in thinking through many of those challenges, we'll need more of that innovation and creativity that many of you have already shown over the last 14 months. It's a challenge that we know is not confined to healthcare. Now, as many of you will know from your direct experiences, COVID has had a profound impact on the way all public services, including our NHS, have been delivered over this past year. The pandemic has forced us all to think in new ways about the way many vital services are designed and delivered, orthopedics included. And we've all seen a much faster application and rollout of new digital technologies, which have generated a growth in the number of online and teleconsultations. Some of these things have been necessary and temporary changes to get us through the pandemic, but others will no doubt be thinking we make a new and will make a permanent part of the way we do healthcare in Wales in future. We must use this pandemic, I hope, to think carefully and deeply about how we provide services for the future. I know I've urged my officials since my very recent appointment not to waste this crisis. Let's think creatively, let's think differently. And I know that you've all thought deeply about these issues. And I'm sure, and I'm aware that many of the changes you and your colleagues in Wales have made over these last months, and I hope that some of them will be carried forward into the future. The virtual triage of fracture has reduced the need to bring every patient into hospital to be seen in an outpatient department. The use of patient-reported outcome measures after surgery have allowed virtual checkups to take place. Online physiotherapy and rehabilitation has changed in a new and innovative ways. And part of my message today is to say that I welcome a wider conversation about the role of these and other changes in the way we go about supporting a sustainable and effective NHS for the future. As a Welsh Government, we've said many times that we have no monopoly on good ideas, and we look forward to hearing your reflections and observations on these changes. And that conversation itself rooted in very Welsh values, values of social justice and of fairness. Not being able to offer vital orthopaedic services over the last year has no doubt impacted those who have lived with limited mobility, perhaps for some time. Uncertainty over when they can be treated has no doubt been a difficult and painful experience. And that's precisely why at the recent election, we proposed the biggest and most comprehensive plan for NHS recovery Wales has ever seen, because tackling it is itself a matter of social justice. And I want us all to work alongside and with those who've lived through the experience of waiting for treatment, to use their knowledge and understanding to ensure that we develop services that can genuinely improve care across Wales, harnessing the experience and the skill of staff to rebuild a first-class service. I know that the difficulties in managing waiting times for orthopaedics in the UK and within Wales existed prior to COVID. We know that some clinics were not able to operate during lockdown or had to operate on a reduced level. We know that operations were cancelled. We know that support services such as physiotherapy and radiology were diverted away from orthopaedics in order to support the COVID response. Now, this has inevitably resulted in backlogs of care and has been why the Welsh Government has committed an additional 100 million over the next year to support elective recovery. It will take us time to work through the waiting list that is built up, but we'll do so by using and building on all of those new ideas that have been developed. We'll continue to use new intelligent pathways and new innovations to improve not only services, but also the wider experience of patients. And I know this isn't going to be easy. You will have heard from colleagues in the Welsh Orthopaedic Society yesterday of the challenges we face. The Welsh Government and the NHS Wales are working with the Society through the Welsh Orthopaedic Planned Care Board to develop a clinical vision and strategy for orthopaedics. I expect this to support the development of a truly multidisciplinary workforce that equals the clinical demand. That will ensure that all patients within Wales have equality of access to routine and specialist surgical care. That care is provided in facilities and within systems that support both staff and patients. We need to be brave as a country and look to redesign how we deliver orthopaedics. Part of this will require the Welsh Government and NHS Wales to take creative and innovative decisions moving forward. Decisions that we can support not only the health and well-being of our population, but to make sure that that contribution to fairness and social justice that I've just talked about is also seen through. I know that the coming months and years will be challenging, but I have every confidence that we can develop a long-term vision for orthopaedics that is bold, that is practical, and which above all delivers the care the population of Wales needs and deserves. I want to thank everyone today for their truly remarkable efforts this last year, both within Wales and within the wider British Isles. Your work has truly been heroic and it's been valued, and we thank you. Diolch yn fawr iawn i chi gyd. Thank you very much, and thank you for the invitation to come and speak today.
Thank you very much, Baroness Morgan, for your kind words. And we are very encouraged to know that you as leaders understand the minute details of the challenges which the current NHS is undergoing. And we pledge to help our people with the best we can offer.